I'm Graham Theisen, an infertility specialist with Piedmont Reproductive Endocrinology Group in Charleston, South Carolina, here to answer all your infertility-related questions. A topic that I bring up to my patients all the time is genetic carrier screening. And I'm always surprised by how few people have actually heard about this after having been seen by their OBGYNs and other doctors out there, because genetic carrier screening is actually something that's really important. It's cost-effective, and it should be available to anyone that's thinking about having a baby with or without infertility. I always tell patients that genetic carrier screening doesn't really have anything to do with infertility at all. It has just more to do with sort of preconception counseling for anyone who's trying to have a baby. It's something that we think of as important these days, and especially as genetic testing has become a lot less expensive compared to a decade ago. It's something that we can offer to most patients who are trying to have a baby, again, with or without infertility. So let's take a look at some visuals as we talk about what genetic carrier screening actually is and why it's helpful for any couple that's thinking about having a baby. So whenever a couple asks me about genetic carrier screening, I always have them think about themselves first. So each of us has 23 copies of each chromosome, right? We get one set from our dad and one set from our mom. And so that basically means, excluding the sex chromosomes, which we'll talk about later, that for the vast majority of our genes, we have 2 copies of every gene. So genetic carrier screening is looking for diseases where if you just have one of your 2 copies of a gene mutated, you're totally fine. So you don't have any symptoms at all, you would never know. You need to have both copies of the gene mutated in order to actually have a disease. So in this case, let's look at cystic fibrosis as an example. Cystic fibrosis is caused by a gene that exists on the 7th chromosome here. So let's say we have one parent here, and you can see that one of their chromosomes has that red, that'll be our mutation, and the other one is just a normal copy, which is green. So this parent would be totally fine, no symptoms whatsoever. But then when we go to make sperm and eggs, what do? We divide our genetics up, right? So you can see the first thing we do is when we're making sperm and eggs, we divide our chromosomes completely first. So we'll see them dividing here. And then we divide them again, like this. And each one of these is going to go into its own sperm or egg. So in this case, we have sperm here. And then let's say that this person has a partner who's in the same condition, all right? So let's say this is their female partner, carrier for cystic fibrosis, mutation in one chromosome. The other copy of the gene is normal. So again, they're going to split up their genetics, and each one of their eggs is going to get one of these copies, right? So if we allow these to go into each one of the eggs and sperm, and then we'll just mark which is which, basically with red and green here, red being mutation and green being normal, we can just see what happens by chance alone as far as which children they might have that are actually affected. Okay, so you can see here where these 2 line up, where sperm and egg line up, that's the quote-unquote child that would come from that particular pairing. And you can see in the top left corner where there's red and red, those are the situations where a child would get a mutation in the sperm and a mutation in the cystic fibrosis gene in the egg. Those children would be affected. So it's basically 4 of 16, all right? So let's look at the other possibilities. So here we can see that either in half of these kids, they got a mutation in the sperm, or with a normal copy of cystic fibrosis gene in the egg. Those would be normal, so this is in the top right quarter. And then in the bottom left quarter, we see where they got a normal cystic fibrosis gene from the sperm and a mutation in the cystic fibrosis gene from the mom in the egg. So all of these people, this would be 8 of 16, or half of the children, would be carriers, like the parents are. And then finally, you can see this bottom right quarter here, where these kids just happen to get a normal copy of cystic fibrosis gene from the sperm and a normal copy from the egg. So these kids are not even carriers anymore. So they are unaffected and carriers, or unaffected and also not carriers, sorry. And so what I always tell patients is that, okay, so what we're looking for are these things where they both match up for the same disease. Because in general, for most of these, that would mean that 1 in 4 of their children end up having whatever disease they happen to both be carriers for. So cystic fibrosis is a really common one, but there are hundreds and hundreds of diseases like this, which are the exact ones that we test for in genetic carrier screening. When a couple does test positive for the same condition, we typically will have them do genetic counseling with a certified genetic counselor to get an idea of what the implications are for whatever that disease they happen to be carriers for actually is. In these situations, one thing that infertility specialists offer is the ability to do IVF with PGTM, essentially testing embryos to see which ones of those embryos are actually affected and which ones aren't, and then only transferring those embryos that are unaffected. 3 out of 4 embryos should be either carriers or completely unaffected by chance alone, with only 1 in 4 actually being affected by the disease. And IVF with PGTM lets us know exactly which of those is which, And then again, only transfer those ones that are either carriers, like the parents are, or totally unaffected non-carriers.